Hi, this is Kim McAllister, and we're now beginning Health Education Part 4. We're going to talk now about health literacy. Health literacy is the measure of how a patient can understand, comprehend, and utilize the health information that we give them, or the instructions that we give them to carry out some type of health function or some type of treatment, self-management, and so on. Health literacy can be affected by a number of things. It can be affected by the person's level of education. If they have poor educational attainment or very little educational attainment, they may not be able to read and understand a lot of the health information that's produced. We need to be producing that at the 6th grade level or below, but much of that information is not at that level. It's at a much higher level. We also need to understand it can be affected by language skills. So people that have difficulty communicating and understanding communications can have a great deal of difficulty with health literacy. Many people that have problems with health literacy can be ethnic and racial minorities, because a lot of the materials were written by people that were not racial and ethnic minorities, and so they're more focused on people who are not members of a minority or ethnic group. This is also one of the problems we've had in general with education, is a lot of the people creating standardized testing, and a lot of the testing are not people of ethnic and racial minorities. And so we need to include people that have training in those areas, and we need to improve our own education of races and ethnic groups that are different from our own, so that we can provide the best possible information for people. Also, people who are elderly, they may have a poor attention span, they may have trouble reading, they may have poor hearing. All of these things can contribute to educational literacy problems. Also, the elderly are more prone to have other problems like dementia, Alzheimer's, other things that may be impacting their ability to understand and carry out what they need to do. People with chronic conditions of any age are also at higher risk for poor health literacy. They simply may not feel well enough to handle or take care of their condition. If they have multiple chronic conditions, that puts them at even greater risk. Also, with chronic conditions, patients can have depression and other problems, and that just may not be, they may not be at a point where they are teachable at that moment, and so you may have to use some other strategies to help them. I have a resource of different health stories, and this one shows someone at a doctor's appointment who does not understand what the provider is saying to them. This person has had some kind of injury, and he goes to the provider. The provider walks in and just says la 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 la, and does not do anything to determine whether or not the person can understand them, or did not find out anything about their language. And so often people will nod or say okay, unless, if you just ask those closed-ended questions. Do you understand? Does this make sense? They'll say, okay. So you need to be asking open-ended questions so that you can find out if people really are understanding you or not. And you can see the provider continues to speak, and this person continues to say yes or no. And then they've picked up their medication, and they don't speak English. This is all written in English. And then the other members of the family say, what did the doctor say? And they have no idea. So you can imagine how helpful this type of information was for that person. So some clues that people are having problems with health literacy is that they aren't able to read the printed material. You can hand it to them and ask them to read it to you. If they ask if they can take the material home to talk it over with other people first, that's an indication that they may not be able to read it or understand it. If they tell you, I left my glasses at home, or I'm too tired to read it right now, that can also be a clue. People don't want to admit that they're unable to read or that they don't understand things, and so it's important to figure these things out. If they say they've read the material but they don't have any questions for you, it may be that they really understood it, but it also may be that they didn't and they're not comfortable asking questions. It also could be over a sensitive area or something that may be embarrassing to them, and so you need to really find this out. And also, if they don't want to discuss what they read, if they don't want to tell you what they think about it or what questions they have from it, or if they don't want to engage in any other conversation about it afterwards. So how you can help your person that has poor health literacy is, first of all, assess their reading skills. Then you want to find out what it is they want to know. Don't make assumptions about what they already know. You want to focus on the essentials. You don't want to overwhelm them with a lot of information when they're having trouble understanding health information. Be very clear and concise. You want to remember that this person may not have any prior experience with a health condition, and so you want to be very specific and maybe give it to someone else who's not a healthcare professional to look at it before you provide this to the patient. Develop a glossary of common terms. If this person has a lot of terms that they don't understand, you can construct a glossary for them so that they have something that they can look at. You also want to plan these educational experiences over time, getting back to sticking to the essentials and not overwhelming them. Giving information in small pieces can be very helpful also. You want to use pictures whenever possible. Pictures that, now we've got more and more information that's just picture-based, and that can be very helpful. Also, demonstration. If you're not sure that they understand written directions, then show them what the directions mean. Review the information often. If someone isn't able to read or they have visual problems, then you want to repeat that information to them. You also want to review it often if they're having challenges understanding. There are a lot of YouTube videos and drawings and so forth that you can use that are very helpful. You want to encourage someone and give them praise. Never ever patronize someone because they're not able to understand directions. That could easily be you or I in that situation. So be careful not to be condescending or patronizing, and be careful not to be giving that impression to people. And speaking slowly and loudly is of no use whatsoever to someone who does not understand what you say, and also is demeaning to them and has the consequence of making them angry with you, and then they don't want to talk to you anymore. So don't do that. So the implications are that the vast majority of people have poor health literacy. And we also have an increasing immigrant population with little or no knowledge of English. And in my work with Medicaid, I see that very frequently. When people immigrate to the U.S., they can receive Medicaid for a period of time. I've gone out and performed assessments on patients that are getting Medicaid, and we have an interpreter line that we use over the phone where we call a number and tell them what language the person speaks, and an interpreter comes on. And that can be really helpful. Sometimes in some countries and in some languages there are a lot of different dialects, and so it could take 2 or 3 or 4 calls to finally get someone who spoke the specific dialect of people. But in one instance that I'm thinking about, I had a patient who was a child. He was in school. I think he was in 2nd or 3rd grade. And he and his family had just come to the United States about 6 weeks before I spoke with them. And the boy had a seizure disorder, and the school called me and told me that the child was having lots of seizures during the day, and they had tried to reach the mother, but the family didn't have a phone yet, and they wanted me to reach out to them. So I drove out to the patient's home and met with them. And it turned out that the doctor's office had given this family a whole stack of information on seizure disorders, had written prescriptions and sent prescriptions to the pharmacy, had given them appointments for follow-up treatment, and given, a variety of other things, including a referral to a specialist. And guess what language all of it was in? English. Guess what language the patient did not speak? English. So the mother had gone to the appointment, did not understand anything that was said to her, was not able to read or utilize any of the information that was given because no one took the time to evaluate her ability to understand what was being said to her. So this child the mother had no idea that her child was supposed to be on medication and had no idea about any of the information that was being given. Also had no idea that the child was having seizures at school because the child couldn't remember that he was having seizures, and nobody had shared that information back and forth. So this is a big problem, a problem that people are dealing with every day, and this is another thing that we as nurses have to work on to help the family. So I arranged an interpreter, and then I called the doctor's office. They were all indignant because the mother had not picked up the medication, and I explained that they didn't understand. And so, this took probably a couple of hours to all get sorted out, but then the child was able to be on the medication and improved. So little things go a long way. And it's just, this child could have had very serious consequences because he was not taking his medication because he didn't know he was supposed to. And this is another, just another example of, a parent was given medication to give to the child, and the parent couldn't read the label, so didn't know how much to give, and then the child is so sleepy they can't wake the child up. And here it is again with another father and a daughter. So these little scenarios are kind of neat. And there is this is a really good source to look at. You have to go to the next source. But this is all picture stories that are designed for people where English is a second language or they don't speak English. And so this goes on and has different pictures and so forth that you can use with your patients. So one of the ways that we assess the material that we're handing out to our patients is by using SMOG. SMOG stands for Simple Measures of Gobbledygook. And there is a website here that you can use that has I guess they have taken that down. This is where I got the scale for it, but the information on the website is right here, so you can still see that information. So what you're going to do is try to determine what the reading level of your written material is. And if a person reads at or below that particular grade level that it's written to, they'll understand 90 to 100% of the information. And so we want to aim for a reading level of 6th grade or less. That's the average reading ability of our nation. And that's another discussion. So in order to use SMOG, you want to count the first 10 consecutive sentences near the beginning, 10 in the middle, and 10 at the end. And in these sentences, you want to count all the words that have 3 or more syllables. Those are polysyllabic words. And then you want to add the total number of words. So take your document, look at the beginning, and the first 10 sentences, count those words. In the middle and in the end, do the same thing, and then add up all of the words that you have. And you use this conversion chart to determine the grade level. And so then you would take your chart. If there's 0 to 2 polysyllabic words, it's 4. If it's 21 to 30, it's 8. Most of our educational information and our resources are like around grade 13 or 14. And this is one you use for long materials. If you have something that's less than 30 sentences, then you're going to use this particular number to convert it. But the easier thing is to use this. Also look at the desired writing style. Is it an active voice, like first we do this, next we do that? Is it written in a conversational style? People find that a little bit more motivating and friendlier to use. Is the reading level appropriate for the intended audience? If you're writing something for children, you want to write it at their particular grade level. If you're writing something for older adults, then you want to write in something that's a style that's appealing to them and also at their knowledge level. So it would be at 6th grade level or below. Are the words and the phrases short and simple, and are they direct? You don't want something that's very choppy to read, but you also don't want to be long-winded. Don't go into a lot of detail unless it's really important that you do so. If you use a technical term, if you use an abbreviation, do you define it? Do you state what an acronym or abbreviation stood for? And then do you give some helpful examples? This is all off of the Medicaid checklist. The average reading grade in the U.S. is 8th grade, and so we want to keep things at 5th to 6th grade level. USA Today is written at the 8th grade level. That's where a lot of our newspapers and such are written at. Anything that's above the 8th grade level is considered difficult to read for most of the population. Our informed consent forms, insurance forms, admission forms, the medication inserts. Have you ever opened the insert that comes with your prescription and tried to read it? It's full of all kinds of language that the average person has no clue what that means. And so it's not really very helpful. And so most of this information is written at high school level or higher and seems to average somewhere in the 13th to 14th grade. So that really moves up into the college level. And this is a poster that was completed at Metro Health Department in San Antonio. And this is just an information board on how to keep your child from being exposed to lead. I was working with this particular project, and we had students that were going and checking lead levels of children in certain at-risk areas in San Antonio. And so you can't really read the information on it very well, but it was minimized with polysyllabic words. It had lots of white space and had some contrast and had graphics that made all of it appealing. So when you're developing something that's either a brochure or a poster, you want to be sure you have a certain balance between the information that you provide and then what's called white space. White space is your background. So in this case, your white space is kind of a yellowish green. So by doing that, it kind of leads the eyes to move through the presentation, and it's not crowded. and it makes it pop a little bit. So that in a nutshell is health literacy and how to create readable materials. As you do your teaching project, you're going to be either using products that have already been developed or develop your own. And so you want to be sure that you're careful about the reading level of your information.